We provide a lot of equipment in NSPs, and they're all for a specific reason. As we mentioned in earlier times through this training video, genetics play a big part in injection. Some people have great big ropey veins, bless them, and they can inject for 50 years and not have an issue. Some people have very, very small veins, especially women and Asian women particularly. Even the standard 27 gauge needle could be too big, and the steel, the lumen of that might be a bit hefty for the vein to tolerate. So we do offer 29 gauges. A lot of people who have been exposed to needle and syringe programs down south or more long term know how to use these. The only thing you need to know that is different to the standard 27 gauge is they are smaller. They're the smallest equipment we provide, and so the whole part, the lumen of the steel, the needle, is narrower than the 27 gauge. This gets back to pressure. If you intend on using a 29 gauge, it's very important to let your clients know that the rate of depression of the plunger has to be even slower than you're doing with the 27 gauge. The narrower the lumen of the needle, the faster the fluid will be coming out the tip. So if you're using a 29 gauge, which is a great idea for people with smaller veins, just be sure that they're aware to go slower. If you're feeling resistance or pressure when you're depressing the plunger, that's telling you to back off. It needs to go in a little bit slower. Prescription opiates require different equipment. If we're talking liquid prescription opiates, people get access to morphine vials, for instance. It's just a fluid, so they can't even use the 27 gauge. It might be best to use the 3mm or the 2.5mm and a 26 gauge. The whole process is exactly the same. The mechanics of injection is what we've just gone through, and it's the same for each equipment. It's just different agility around using the hand, dexterity, and especially if you're using methadone with a large amount of fluid. People with smaller hands might find it difficult using the different size equipment, but there is a trick to that too, which we'll get to. It's preparing the drug that is the real important part. Filtering and dilution of the drug is what protects the vein and also reduces the amount of crap that you're trying to withdraw from the drug before you put it into your body. Pills have binding agents that gives them shape, otherwise everything will be liquid. I know I keep talking about opiates, but it sort of covers a lot of areas, opiates, and it's quite easy to deal with. Remember we said earlier that when we're mixing up the heroin, that opiates become one with water. So everything that doesn't become part of water is what we're trying to get out. And there is a process to do pretty much any drug you can break down to an injectable form, except for your gel-based capsules, your temazepam and Normacin. It's impossible to inject those safely. What gets down to cleaning things correctly, remember we were talking about swabbing. The end of your syringe, the flat part of the plunger, is a great little working tool. Your swabbed out spoon and your base of your plunger, it's your mortar and pestle basically. So adding water, crushing the pill, adding more water until you have a fluid substance, attaching a syringe, a good way of doing it, because remember this is sterile stuff, so you want to try and keep it as clean as possible. Just cracking the top off and connecting like that. So I haven't touched anything, it's quite important. Filtering is important. You can't filter too much and you can't dilute too much. Dilution does not mean weakening of the drug. Quite an important message to get across. A lot of people just assume that dilution means you'd be diluting the effect of the drug. It's not true. Remember, the stuff you want becomes part of water. We're all very clean hands, as we showed earlier. We've broken our pill down, we've made it a bit milky and a bit chunky. We draw it up as many times as we can through the cotton filters. We put another one in there, pushing through the cotton filters. Do this as often as is necessary. This is a long process. What people are doing is chemistry. It's not something you can do in 2 seconds and get away with it safely. We're trying to reduce harm here, so people need to do this over time. Do this as many times as you feel that you have got an injectable substance. Then we come to one extra step. These are called wheel filters. Not every NSP has access to wheel filters, so you've got to be realistic in your education to your clients, but they are available, and contacting your area manager or your area trainer in regards to needle and syringe programs, they should be able to access them quite easily. Great little devices. Anybody who's had a blood transfusion has probably seen a larger version of these. Basically they remove most bacteria and fungus and even some virus. They come in what's called different micron levels, right down from 0.2 of a micron up to, I think it's about 12 microns. The green one, which is 0.8 of a micron, is sort of your standard ubiquitous one that's very good for removing chalk particles and also good for methadone. Ideally somebody would be putting their drug through this, then through the 0.2 as well, and getting a very clean drug. You get clients onto these and they'll tell you that the taste of the drug is a lot better. They get a better effect from the drug, plus they're quite pleased with the fact they're reducing their long-term harm through their injection use. And as we talked about way back early in this training video, you get someone becoming active in their own health and improving their injection technique, they're going to have better health outcomes, and they're more likely to take more serious look at what they are doing with their own body, making some informed choices, and be appreciative of the people who help them along the right path to be having a safer lifestyle. And you might get some very meaningful dialogue later on. What you need to do with these, you've got to prime them first. So you can get another syringe. Just suck up a little bit of water, about 1 ml will do. Connect it to your wheel filter. This is priming, you're getting ready for hyperabsorption. Just push it through, just moistening it basically. These are a one-way system. It doesn't matter if you pull the drug up through the wheel filter or push it through, it doesn't matter. It's your own personal preference, as long as you're doing it as a one-way system. Here's the drug we prepared. This is contaminated now, this syringe, because this is the one we were pushing it up and out through the spoon and the filters. So what I do, get my drug that I've filtered as many times as I think it's a clean solution, attach it to my wheel filter, get another needle. That's a screw on, which is good because you don't want to blow that off because it might waste the drug. Have another clean syringe, pull it back, put the needle into the new syringe. So we're going from a clean environment to another clean environment, again reducing the amount of contaminants we're likely to put through. Go through slowly, give the wheel filter a chance to do what its job is. If it's blocking, it means you haven't filtered in the earlier process adequately. So you might need to put some more water through there, more sterile water. Take that out. Everything we've used to this point, except for that part, that's the good stuff, is a throwaway. It can be quite expensive, but we're talking about your long-term health. Attach your needle, and away we go. Again, using the process we demonstrated earlier with correct swabbing, angle of entry. That's how you use a wheel filter.